We are coming to the end of the 5th Maruzza Foundation Congress. And I'd like to thank the organizers for putting this on. I'd like to thank you for the honor of being the co-chair this year of this conference, which indeed is a very, very big honor. And one of the things is that together with my partner in crime, and Goldman, we have the chance to reflect a little bit of what we have heard over the last few days. And are we listening? Really listening was the theme of this conference. And I think what became clear is we came a long way. Children's palliative care, pediatric palliative care came a long way. And boy, do we have a long way to go. Are we listening to the children? We found amazing examples in the posters, in presentations, of members of the interdisciplinary teams of nurses, social workers, child life specialists, nurse practitioners, doctors, psychologists, chaplains, everyone to really explore the voices and make them more heard. We're doing well. And thank you to Amy Volans this morning to remind us that Dr. Octopus actually does go to heaven. And there are many things which were a disaster. We learned about the dehumanizing COVID restrictions hospital administrators put in without listening to children, without listening to parents, without listening to everyone. We talked about that in many cultures, in many countries, difficult news may not be shared as well with children as they should. And it was great to listen this morning to Arnaldo Pancarazzi when he's saying, when he reminded us that every culture is a mix of positive and negative events. He invited us to challenge the notion of culture as something monolithic which we just can't change, but rather, we are children of our culture. We're not slaves of our culture. So we can slowly change the culture in our institutions, in our regions, in our countries, on our continents, with our families. Are we listening to the healthy siblings? What do you have to do in this family to get some attention? We learned amazing examples, again, on the posters during the conference, about memory making, about clinicians and of the team who are working with the healthy siblings and the sick children together, also of bereaved children, to really make sense of this and to go on. And we have to accept, when we look at our own programs, often this is our last thought. This is the weakest link. The healthy siblings, the children of in those families who really may not get enough attention because we're struggling even having enough clinicians to take care of the sick kids. We need to do better. Are we listening to the parents? Well, we heard some examples of things which are really going well. And we heard from Melissa Pratt from South Africa, and who reminded us how the parents of sick children, of children with serious illness, are often not part of the picture. Teams are rounding outside very quickly, and I've used the term, I'm guilty of this, of difficult parents. Thank you for reminding us that there is no such thing as difficult parents, but difficult situations. And wasn't it fantastic, thank you Michelle, and thank you Melissa, of using the acronym of LISTEN, of what are do's and what are not do nots at this time. And there is conflict, there always will be conflict, and that's normal. So learning again about this great example of mediation, of acknowledging this we have different point of opinion. That's okay. We can agree to disagree, but how do we go from here? I think where we have come, looking at, I had the privilege of being at every single Maruzza conference, 1, 2, 3, 4, and 5 now. We are really getting better in listening to each other. I think we are the only specialty in medicine who truly is working year by year to becoming more and more interdisciplinary and transdisciplinary. What other conference are you going to in cardiac surgery or orthopedic surgery or dermatology where you have such a breadth and width? And I really want to acknowledge the speakers up here on the forum and the groups, on the posters, and that we really truly are learning from each other. Those of us who are physicians, those of us who are doctors and have been in business for quite some time, we know we cannot do it alone. It is impossible to do pediatric palliative care as a single person. If anyone thinks, a doctor or a nurse, he or she can do it alone, it's not going to happen. It is impossible, the model is wrong. We always must do it and look through different views, look through different lenses, and then think together what might be, what we can offer. Because palliative care is offering extra layer of care. We're not taking over. We're providing an extra layer of care. And in the spirit of every doctor can prescribe an antibiotic, but we still have infectious disease specialists, I think what we're doing well is helping our colleagues to provide primary palliative care. We do not need to see, as palliative care specialists, every single child with a serious illness. We will never have the ability. We have by far the most specialists in the United States. You heard from Justin, we're training 50 doctors every year. That's a lot. That's 102. That's 150 in 3 years. That's a lot of people. It's also a big country. There are lots of children's hospitals, and we're still understaffed. We will never be able to see all those kids. So listening to us interprofessionally, but also, and I think that is the kicker here, is that we're learning from each other. Truly learning. Often there's like an arrogance at medical conferences, which are somewhere in the United States, where it's basically the best healthcare is done in America, and this is sort of what we're presenting. And then, of course, there's something from the UK and Australia. So it's like this English-speaking country, sort of research-driven, which is there. And this is less and less happening here. True, we have research, but much of the best clinical work and much of the best research is actually done in amazing countries. Yeah, Lisbeth, Geseda Tristan, we had a discussion, you will not remember, 21 years ago, and you told me what you were doing, and you told me that you use methadone for children as the first-line medication. I never heard of that. I was just at the beginning of my career. I've implemented this into Epic Pediatrics, into Pain Masterclass. Yeah, Justin and I were doing methadone left and right as the first medication. So this was starting with, which in the 1990s, which started in Costa Rica, and in Poland. So we're really learning from this. Yeah? When I was in Africa, I was amazed of like what I didn't even know that I didn't know that I didn't know, what Michelle was telling me. So truly learning from each other is another, I think, strength. And we noticed this at this conference of people really coming here. And certainly as a German American, I became very, very humble of what we sort of know and really what we don't know that we don't know. We have to do better. We're doing really well, and we have to do better. There are 21 million children right now who could benefit from palliative care. In my country, the United States alone, there is a Boeing 747 crashing every 10 days full of children with life-limiting diseases. One Boeing 747 for the United States alone. 416 children every 10 days dying of a life-limiting disease. We are the best resourced country. We have the most pediatric palliative care specialists. We have the most researchers in the area. 90% of those children in the United States still die with unrelieved pain and distressing symptoms. Most of them do not have access. So we are struggling in an amazingly highly resourced country. And then we have to remember, thank you, Mercedes, for reminding us, 2.5 million children are dying worldwide every year without morphine. It would cost $5 million per year to provide morphine for every dying child in the world. $5 million. We still don't pull this off. We still have opioid phobia. Yeah, and you hear from, when we just heard this amazing talk, how countries really have changed. You saw that India, in every region, this is now available. South America, it's there. It's getting better. Yeah, thank you from hearing from Africa. It really is getting better, and then more and more project. And at the same time, we have those maps up there, and we see like Germany in dark blue, and North America in dark blue, and Australia in dark blue. That's all fantastic. But still, the majority, even in the rich resource country, need to do much better. And that's nothing in comparison to low-income countries, where we need to do much better. So finishing up, listening, really listening. Again, I appreciate my friend and partner in crime, Justin Baker, who reminded us of the difference between sympathy and empathy. Jan Aldrich this morning reminded us, I guess, on the importance of holding this space. Our job is not to fix it. Yeah. Melissa, there's nothing I can do to make this better that you lost a child. And that's not my job. But we can listen. And we can hold the space. And we try not to fix it. As Justin says, jumping into this hole, going down into the hole, and be there rather than waiting for the person to stop so that I can say something intelligent. We had, and I'm 1 minute away, and from you able to come up here. Oh no, I have the poem, 2 minutes up. We had a fascinating meeting yesterday regarding Ukraine. And this is a war which unfortunately probably is going to go on for years. Yeah. That's what most experts are saying right now. So we have to be in for the long term. Yeah? This is not just like the flavor of the week or the flavor of the month. This is going to be on a long time. We probably, unfortunately, I'm very afraid that in 2 years at the next Maruzza Foundation, this war still may be going on. But maybe I'm wrong. Maybe there is something magic will happen and things will be much, much better. One way or the other, we promised that we're going to remember. And again, under John Marston's leadership, there's now the Declaration of Rome. I think it went through about 53 iterations overnight. And so currently the draft is up on the Palliative website. And you will all get an email, and you will be invited to sign it. You will be invited to pass it on through your channels and your colleagues. And you will be invited to think for one moment, what can we possibly do? Because talking here on a microphone in Rome is not going to make any difference unless we really, truly do something. And this could be donating money, good time, expertise, if you notice. And there you saw these different areas of possibility of adding on. Thank you again to Sylvia Lefebvre, amazing sister of amazing Maruzza, to really have been able to support this and really bringing us together and making this truly the only and the largest truly international pediatric palliative care conference, really covering all continents. We have to get some penguins eventually from Antarctica so that we go from 6 continents to 7 continents. But other than that, yeah, everyone is here, which is fabulous. Stefan. Thank you, of course, to the Franca Benini, who is the powerhouse in Italy and the world to make things happen. Thank you to all the speakers. Thank you to those of you who submitted a poster. Thank you to the scientific committee who worked very hard. And thank you for allowing us to do an EPIC Pediatrics course. You've heard it a few times. I'm obviously very biased, being the principal investigator. We have now, EPIC Pediatrics, for those of you who don't know, is a train-the-trainer course. So you take part of this, you become a trainer, and then you get all the material. You get all the PowerPoints, you get all the movies. And then you heard it was translated into Spanish and French and Russian, so we have different versions. So we have the opportunity in 2 hours to start our 23rd EPIC Pediatrics Train the Trainer, and 41 of you from 15 countries decided to attend, and we will have an amazing day today and tomorrow. All right, I'm finishing up with a quick poem, and then I will ask Anne to come up. I started with one of my favorite comedians, Gilda Radner, and I'm going to finish with Gilda Radner, who, as you know, died much too early in 1989 of ovarian cancer. And when she was diagnosed, she wrote the following: "I wanted a perfect ending. Now I have learned the hard way that some poems don't rhyme. And some stories don't have a clear beginning, a middle, and an end. Life is about not knowing, having to change, taking the moment and making the best of it, without knowing what is going to happen next. Delicious ambiguity." Thank you very much.